Good morning, everyone. This is Patrick Viginius. We'll wait another minute or so before we start. Okay, good morning. Again, this is Patrick Viginius with Flywire. Thanks for attending this morning with the kickoff to Region 5 HFMA's virtual digital webinar day. It's my pleasure to have the opportunity to talk about Advent Health and how they've been able to transform their end-to-end patient financial journey. The agenda today, we're going to go through a variety of slides. It'll probably take about 30 to 40-ish minutes. And then at that point, we'll open it up for any questions that anybody may have. So looking forward to being able to share this information with you this morning. So just real quick, just got a couple introductory slides about who Flywire is, if you're not familiar with us. First off, Flywire is in three different verticals across the globe here. They are obviously in healthcare, but also in higher education, as well as the travel industry. Within healthcare, our main focus is helping to help our provider clients solve their most complex payment scenarios that they face. And within that, we have a financial engagement and payment platform that helps modernize the way that providers communicate as well as connect with their patients and collect out-of-pocket balances, with the goal of obviously to improve the overall patient financial experience and support increase in the overall self-pay performance. Flywire within healthcare, we serve four of the largest health systems in the country. One of those is Advent Health that will excited to be able to step you through the journey that they've been on with us here for the past 5 years or so. As well as when you look at the overall experience that Flywire has across the industry. Last year, we processed over 10 billion in patient responsibility payments through our platform. So we have a lot of insights that we'll be able to share with you as well from that experience. A little bit more background about who Flywire is. We've got 10 plus years history within the patient financial care industry and have a lot of experience with introducing into the whole patient engagement and payment space, several areas that have innovated and improved upon the overall process. And this just gives you a snapshot of what some of those look like. One of the things that we're excited about is a little over a year ago, we merged with Simply. So through the combination of Flywire and Simply, we've been able to introduce to healthcare these different areas. One of the most recent ones that we'll dig in a little bit more detail about is this AI-enabled conversational chatbot that we're excited to introduce you to. Digging in more into the learning objectives for this specific session, the first thing we're going to talk about is some industry data that's been out there and some other consumer global research that really talks about the growth of digital channels that is a result of what happened with COVID-19. We're also going to highlight a little bit more details around recent patient surveys data that that highlights the importance of how you approach helping those patients address the affordability crisis, And then wrapping it up, we'll step you through in more detail the Advent Health experience to bring all of this to life. So in terms of consumer expectations, especially as you look at what's happened here in the last year as a result of COVID, it's become very clear, and I think everybody would know this from their own personal experiences, that there's been a tremendous need for making that transition as much as possible to digital solutions, and then within the patient responsibility space, how you approach patients with affordable payment strategies is another really key strategy that has been in place for some time now, but it really, again, was exacerbated here because of the result of COVID. In terms of what the expectations, healthcare is fairly unique in that we are faced with the same challenges that other industries face in this rapid transition to everything that's on can be accessible now through your mobile device, as well as everything is shifting more towards an online experience. So part of the challenge that we face in healthcare is the expectations that patients have from real positive experiences that they encounter outside healthcare, that they now are taking those expectations, expecting us to adapt and be able to provide the same convenience that the Ubers of the world, or DoorDash, for example, has probably been one that is maybe a better example that has really obviously grown here in the last year. But being able to provide those patients that same easy user experience through the device of their choice is a real key strategy that we're seeing increased interest from all of our clients out there. And digging a little bit deeper and hopefully providing you some insights into what other industries are talking about from a global perspective, we thought it would be helpful to step you through some key statistics and results that a study that McKinsey and Company launched quickly last year after COVID had hit. And this was a survey that went across 45 different countries. And one of the things, probably the most important and most fascinating result that came out of it was that, overwhelmingly the response was from a global perspective, was that this expectation around digital adoption had vaulted forward in 5 years within a matter of 8 weeks. When you stop to think about that, it's pretty amazing to see that, again, the path that we had already been going on from a digital perspective was already in process and was growing at an incremental base each year over year. But because of COVID, this dramatic shift has really changed consumer perspectives and expectations on all of us that providers need to be aware of and to evaluate what different strategies they want to take. Some of the key things to take away from this data is 75% of first-time users of digital will continue to use it based on that positive experience. Based on everything that's happened with COVID, there's also been a significant increase of time that is being spent now online by consumers, and that's the same case in healthcare as well. And there's the expectation of 29% of patients that even after we're through COVID, post-crisis, that digital is going to continue to play a critical component in everything that we do in our lives, from ordering groceries to ordering takeout to obviously Uber, airline industry, all the other things that touch upon us in our day-to-day lives. Some of the other key things that, as you look forward, strategically and how you want to adapt each of your organizations from a digital perspective, being able to provide a strong digital experience and increasing the adoption of that is here to stay. And so one of the things that we're starting to see from our client base was a greater emphasis around how they view digital strategies as a differentiator in not only to capturing new patients, but also to ensuring that their loyalty to the organization stays the same, and digital really is at the forefront of that. And that really aligns with what this industry analysis has shown. In the case of 73% of those consumers expect to be influenced about who they buy from and who they spend with is all determined based on that positive digital experience. So something to keep in mind if your organization hasn't yet ventured into really focused on the digital side, it's definitely a high recommendation to really start doing that and to accelerate those efforts. From a Flywire perspective, one of the first things that we did when COVID hit was to quickly identify across our client base what impact this had as well for our clients. And consistent with what the McKinsey study showed, we saw ourselves a very interesting transition from where the total payments were coming from, whether that was from an offline payment versus an online payment or mobile device. So as you can see in this graph, very quickly, when you compare to what the trends were starting back in November of 19, once COVID hit, down from the offline payment to more of a digital adoption rate. So that is further evidence about the importance of really investing and seeing where there's gaps today that you may have on a digital perspective. Take it a step further, the Wall Street Journal also did an analysis of this at the end of the year of last year, and they themselves also saw within healthcare a shift from overall credit card spending rose from 40% to over 50%. So again, just more data to help further justify any investments or as you look at making your own digital journey investments on the importance of doing that. It's hard not to talk about in healthcare especially, and this again even goes back prior to COVID, around the affordability crisis that we face, especially with high deductible health plans. It's a common acknowledgement that's been in place here for many years now, and unfortunately last year with COVID, it only exacerbated that situation. Has now increased the need to ensure that how you engage with your patients, what different payment arrangement options that you provide for them, whether that's in-house payment plans versus financing. It really needs to be at the foundation of everything that you do in helping those patients, especially those that can't afford their balance. Some of these statistics maybe are new to you, but we've now seen a shift that 43% of households now are inadequately insured, and that 13 million plus Americans lost their insurance last year, which has again exacerbated this issue. And the end result of that is 50% of U.S. adults have reported them or a family member did not have necessary care due to overall cost. So obviously, the more that you can proactively identify different ways to approach your patients, even promote that with them, even from an engagement perspective on statements, things like that, which will highlight a little bit of what Advent is doing, is really, really critical. To help kind of bring that a little bit further aligned, there was also a study that Flywire did with payments.com, which is a global financial fintech news source, and they had in surveying over 3,000 different consumers across the country. There's several different key insights that really validate the information that I just highlighted about the importance of how you approach patients that are struggling on the affordability side. Some of the things that they've identified here, if you're not already doing it, is number one, the popularity around payment plans. So that's clearly something that it has been in healthcare for many, many years. But we've definitely seen a huge shift of more and more providers being more proactive in offering different payment arrangements prior to service, even off the estimate, to even as they post-service. Leading with payment plan offers, for example, is a key thing to do, which falls right in line with what the results of the study highlighted, which is, again, 44% of the patients found that to be a popular choice. And then another key component of this is, the performance of payment plans themselves. So of these patients that were surveyed, 94% of them were on the path to fulfill that payment plan obligation and pay it off by the time the term was over. And then another key piece in all of this, as I referenced before, and we'll talk a little bit more in more detail about Advent, is now the importance of offering even a payment plan even as early as pre-service and off of an estimate. So with price transparency and everything that's happening and that's been initiated this year, that's another key strategy that is highly recommended that you evaluate and figure out how you can provide that type of offer to patients even as early as pre-service. So real quick, before I jump into a little bit more details about the Advent story, just to highlight a little bit more about how Flywire approaches this and solves these problems for our clients. The model ourselves that we have within our financial engagement and payment platform is really three key pillars. And it really evolves around Insight, which is a predictive analytics engine. So when you really look at how you're engaging with patients, it's really important to really have that consumer mindset and look for ways to leverage data to help you identify not only which patients might have the affordability challenges, but also what is their communication preferences or conversational profiles. So one of the things that Flywire does is at the core of this is that predictive analytics engine that is able to tap into and utilize all of the consumer behavioral data that we capture each day across our client base to be able to build these different profiles and identify proactively which patients fit within those profiles and then immediately begin to engage with them. And one of the big shifts in this is the transition to an omni-channel communication platform that really has that shift on the digital side to engaging from a texting perspective or from emails, as well as now introducing live chat or even chatbot technology with how you're engaging and communicating with patients. The way that Flywire views things is that the analytics as well as the engagement, together is really critical to ensure that you're driving the response or getting and encouraging the patient to go to the payment experience and to view their different payment arrangement options. And then for them in a very easy, intuitive self-service experience, pick and choose what is the most convenient offer for themselves. And then to make that payment very similar to what they do outside other industries where again their expectations are being determined from the Amazons of the world and Starbucks and all that contactless different experiences that come into the mix. So just bringing this to life a little bit more, one of the things that we also do throughout the engagement experience is really evaluate at the individual account level how that patient is responding to the different digital engagement offers that we present to them. So in this example, we're just simply showing a patient is qualified for a payment plan. The initial engagement is to start off with an email or text. We track any digital interaction that occurs. We're always tracking what the outcome of that is. And that outcome could be nothing versus the patient opened up a link, they viewed the link, and then again, did they take action or not? So the idea is throughout the patient's journey is to quickly identify, especially with the first interactions, what is that patient's preference and what was most successful, so that I've identified what that patient's preference is, we're going to continue to engage with them in that same digital manner. Another key component of the overall model itself is the omni-channel communication platform that I mentioned. And if you're not real familiar with what that is, in simplest terms, what an omni-channel communication platform is really supporting the shift to digital, but it's also ensuring that what the messaging is, the content of it, regardless of that communication channel, whether it's the paper statement, whether it's text or whether it's email, that there's a consistency of what that messaging is or what that offer is to the patient, regardless of that channel. And this becomes particularly important when you start looking to use analytics and you're really trying to identify what those individual patient preferences are. Having that consistency across the different offers or different channels becomes a key component in all of it. Another piece that we're super excited to talk about and introduce to the market here, which we were the first ones to do so, is this whole AI-driven virtual assistant chatbot. So, unlike other industries that have really adopted chatbot technology, in healthcare, we are at the forefront of really introducing this from a customer service perspective in supporting not only customer service agents and providing for them AI-enabled standardized answers, so it becomes very easy for them to, search their own internal knowledge base to identify the right answer and click and, point and click versus having to type out answers when you're communicating with the patient, to being able to then answer a patient 24/7 any questions they may have utilizing artificial intelligence and the knowledge and the intentions that you've been able to build within it. Another key component of this within the omnichannel side is now the ability to even ask Alexa, for example, what your balance is for, St. Mary's Hospital, or if you wanted to do real-time Facebook messaging, you're able to do that now as well. So it's really now it's critical to be expanding your communication capabilities beyond the traditional ways that we've talked about. Some of the other areas that we've started to see tremendous value in utilizing this type of technology is supporting the whole financial assistant workflows, as well as improving the overall connection to counselors. During normal business hours, there's the ability to leverage the chatbot as well as two-way texting to do outbound call campaigns now, utilizing the estimate to those patients to ensure that they don't have any questions, that they have instructions, they understand what is responsible for them from a financial side. But in the event that they aren't clear on any of that, giving them real-time access now to a financial counselor, for example, that they need to speak with about setting up different payment arrangements prior to the surgical procedure or whatever procedure that is. And then this also applies to around the estimation process. So with the 2021 launch of price transparency and the criticality around that, we're really focused on helping our clients take it to another level, to where not only can they utilize the bot to identify what their estimated cost is, but then transition to that to now, create a more self-service environment where they can schedule the appointment, they can do research on any of the providers in the health system, just a variety of different use cases now that are coming to fruition. And again, this is an area that other industries have really adopted in a very positive way, that healthcare is now, jumping into this, which is real exciting. Okay, so let's transition and end here and tell you a little bit more about Advent Health. So with Advent, they're based out of Florida, and it's nearly 50 hospitals across 9 different states, and they have 5 million. They serve over 5 million patients annually, and they've been a client of ours for the past 5 years. So this has been a long-term journey that we've been on with Advent. That we're fortunate enough is going to continue as they have now made the shift. They're in the process of shifting from a different EMR platform over to Epic. So everything that you're seeing here is critical for them to continue that transition over into Epic and not have that minimize all the investments that they've made from a consumerism's perspective. When you go back and look at what their initial challenges are, they're honestly no different than what a lot of organizations face today. They originally started with a face-based billing process, and the goal was to have that pay in full with little insight whether or not that was true or not. They started to recognize very early on, being in very competitive markets, that they had to really start to shift more towards a consumer focus. And one of the areas that they immediately identified was they had issues around transparency, as well as confusion around what their out-of-pocket expenses were, and all estimates were either manual or there was no ability even to capture any payment up front. And then another key piece, looking at the affordability side, payment plans, were all manually set up as well. So there was a tremendous amount of opportunity to make that shift to a digital engagement and simplify the overall process and give a greater clarity around what the patient's responsibility was. Within that, then they identified these key organizational objectives. Affordability, again, was at the foundation. So this is even pre-COVID, recognizing even, going back to 5 years, the importance of high deductible health plans and the growth of them, and it's amazing even to continue to see the growth. But the reality is they recognize, how critical it was on the statement's much easier to understand, to ensure that, there's different financial options also that are available to them. And then as part of that, being influenced by other industries, really investing in ensuring that they created a much more modern and self-service experience for the patients on the financial side. And then finally, at the end of the day, the more that we can simplify things, they recognize the better it made, the overall billing process and more friendly and interactive. So some of the things that they immediately did is went through quite a big shift in design of the statement itself. So that was one of the strategies that they implemented. As part of that, they also recognized on the affordability side that to incorporate payment plan offers within the statement itself, as well as then to include convenient automated payment support, throughout the entire engagement model. And then last but not least, really emphasize that shift around mobile and online access. So that was from anywhere. So even ensuring that they can provide, for those patients, the convenience and access at any time. So some of the things that they did, especially on the pre-service side, it was to take the estimate and now to start digitally engaging with patients and provide automated appointment reminders. That also included with it that personalized estimate. So they were one of the first in the industry to really start taking that action. Within the estimate itself and the engagement, it provided that transparency. So it showed to the patient what their out-of-pocket patient responsibility was. And then they also incorporated different outbound call campaigns that had financial counselors available to step patients through and set up different payment arrangements when they were able to connect with them. Where they are today is we're in the final stages of looking at how we can take this process and now engage with them and create an even more robust self-service payment capabilities off of the estimate. So not only do we identify what the patient owes based off that estimate, we're now also leveraging the analytics that I referenced earlier to identify what is that patient's capacity to pay and to determine should we present to them a payment arrangement even prior to the service itself and set up that payment plan, which is the process that we're launching. So some of these things played a really key role that helped support Advent last year. And so, one of the things that is very interesting that even ties back to what we talked about in the beginning about the data, the McKinsey study, the shift to digital, all those different things, the impact of COVID, obviously that had more of a challenge on financials. Despite all those different things, because of the investments that Advent had made prior to the last 5 years, they were in a very strong position to respond to COVID. And as a result of that, despite everything, they still increased their overall collections year over year by 22%. Within the pre-service side, they also were able to reduce the overall decrease in no-shows, which was extremely important for them, especially in the COVID world. And then as part of this, they also last year saw a 41% increase in pre-service collection rates. And the overall balance for pre-service was, at $211. And then another key piece of data point that really, again, reflects back to the data is this idea of self-service payment. So today, 77% of patients now are engaging in a self-service way, viewing their responsibility, what they owe, ensuring that they understand it, and then choosing the right payment arrangement for them, all without ever having to speak with them. With an agent has led to 77% of all payments now are coming through that self-service process, which is huge. And then at the end of the day, another key data point that we really have a great emphasis on is measuring what the Net Promoter Score is for that organization. So for those of you who don't know what a Net Promoter Score is, it basically is a survey that occurs at the end of each payment that we present to the patient. They can rate that score from a 1 to 10, and they can also answer 5 questions as well as input any data that they want to communicate back to the organization. But the Net Promoter Score itself is measured off of the ranking of 1 through 10, and it only incorporates those patients that have either scored an 8, 9, or a 10 in that process. So the higher the score, that means the higher the likelihood that that patient is going to recommend your organization to other friends or family members, which is ultimately the end goal. So with that said, we are at the end of the point here and open to answer any questions that you may have about any of the information that was provided. I'm not sure if there's any questions out there, or if people that they probably have to unmute their phone if they're trying to ask a question, or if they want to ask the question via chat, you can do that as well. All right, and if there's no other questions, then we can, we're gonna kick off this day on giving you 25 minutes back. Oh, looks like I do have one question. Nope, sorry, so the question was, did I state that this was only implemented, the program for outpatient? No, this is for all patient responsibility, whether that's hospital-based or outpatient or physician office. So for Advent, it goes across the enterprise, home health, anywhere where there's a touch point, we've deployed this process for their patients across the entire enterprise. Thanks for that question. So if anyone else have any questions, they can do it via chat, or if they want to use their microphone. Okay, well, great. Well, thank you again for this opportunity to give you an introduction to Flywire, as well as our partnership with Advent Health. Looks like we're going to give you back a little bit more than 30 minutes this morning before the next session. Appreciate your time, and hope you have a wonderful and safe day. Thank you.